Hello, thanks for joining me today. Scott Spencer, founder and owner of Dental Growth Solutions. Appreciate you setting aside some time to look at this video. Of all the web marketing aspects out there and the components that affect web marketing, what we're going to cover today is certainly the most critical element. And so, we're going to talk about reputation management, a concept most dentists are familiar with. As far as how vital it is, I think many dentists overlook it. So I wanted to take it and set aside a separate video specifically for this. If you're a dentist out there today that's been struggling with trying to manage your reputation, which can be a challenge, or perhaps you just don't understand all the aspects that affect your reputation online, set aside 10 minutes here. I'm going to keep this streamlined, but again, you're going to find it incredibly valuable to the success you have marketing your practice online. Now, I want to start here, talk a little bit about what is reputation management. And specifically, in a nutshell, in today's society, there's so many different listings online. When you look at the internet, there's literally hundreds of listings. And so trying to manage your reputation online can be extremely challenging. So what I do is, that's where I come into play. I'm able to use my software to continually micromanage and monitor all of your listings. Everything from the search engines to the business listings to the directories, making sure that we showcase positive reviews on your behalf and we filter out negative or address those internally so they don't hinder your online reputation. Now, first question I get many times from dentists, why is reputation so important? And I want to start with some statistics because, as I said, it's not just important, it's critical. So first you start here, why is it important? First of all, 77% of patients use online reviews as the first step in finding a dentist. 77%, more than 3/4. So what that tells you that if you have negative or subpar reviews affecting you online, it's going to affect your entire web marketing plan. Because I can drive as much traffic as you want to your website, but if those reviews are there, it's not going to result in patients. So very, very important. Secondly, 47% of patients will go out of network. 47%, nearly half of patients will go out of network for a dentist that has more favorable reviews than somebody with, in network. So what that tells you is they'll go outside of their insurance network if your reviews are more favorable than somebody else. So certainly very important. And again, that's assuming other characteristics, other qualities are the same. And then also, 60% of people feel, is very important for a dentist to respond to reviews. And there's no doubt, and Google now is monitoring this too. So there is no doubt that as a dentist, not only do you want to showcase and filter out the negative, you want to respond to them. You want to be able to interact and show, patients and also show Google and the search engines that you care about your reputation. And so when you have a negative review, it's very important to address it. And when you have a positive one, you can reinforce it. But make sure you're interacting with patients, a negative and positive. And like I said, make sure that you're showing other patients and the search engines that you care about your reputation. So very, very important. Of course, that's where I come in. That's where I help. With my help of my software, I help make sure we monitor all those reviews online. Okay, so now that we've established just how important your reputation is, I want to talk a little bit about how my software works and really make sure you understand the process behind and the different components of my software. And I start with, when you look at my software, it starts with the review funnel. And review funnel, what it is ultimately, it's like a landing page, like a widget that I set up. And it has your logo and your practice name and 5 stars, a way to to review you. And ultimately, what it is, it's really a widget that they land on where they can evaluate their experience with you. And with this review, the important part about my review funnel is how it's structured. If a patient rates you 4 or 5 stars, it will prompt you to go to some public review sites. Now, I determine which review sites, get back to this in a second, but usually I'll send you to Google, Yelp, Health Grades, Vitals, Facebook, Yellow Pages. I take it on a case-by-case basis. What I really want to do is funnel traffic to a site. Almost always I choose Google because that's the most impactful place to get reviews. I'll then choose sites that maybe you have poor reviews on, or maybe sites that are more impactful in terms of search relevance. So I determine it on a case-by-case, but the bottom line, if they're 4 or 5 stars, I direct them to a public review. Now, if it's a situation where it's less than 4 stars, let's say it's 3 or 2 or 1, then you get an internal recovery form where they can complain, they can fill out their complaint, but at least it doesn't hinder your online reputation. That recovery form will come back to you at the office, I get copied on it too, and that way we can address it internally without it affecting your reputation, doctor. So very, very important to understand how that works. Okay. Now, also let's talk about the second part, widgets. You know, how do I get people invited for reviews? Because one of the more important parts is trying to invite as many quality patients to evaluate you, to fill out reviews as possible. So I always start with email and text and print invites. Okay, so email invites usually do a great job. I also get more aggressive with texting and then also with actually print invites if necessary. Usually I don't use those, but they're there. I also like to put widgets on your website where they can review us directly from your website, and then they can land on your site and go to the funnel from there. I also will use widgets on the bottom of your email signature. So when you send them out to patients, they have a chance to evaluate. They get to the review funnel through your emails, which is another way to capture reviews. So now, other things important, invites. Well, that's kind of what I just talked about. That goes along with the widgets. Review monitoring, very important, and reporting. The important parts about the way I do it is I monitor the reports very closely. So every time a review is posted, I get notified. You also get notified. And I also with 3 stars or less, you get notified for negative reviews. I always make sure you get these email alerts, and I'm copied on them so we can make sure if anything's subpar that we're addressing it. Let me be clear, even the best dentists are going to have subpar reviews. So we just want to make sure when that happens that we address it internally, we don't let it hurt your reputation, and make sure that we're monitoring it on a continual basis. So you also get reports every month. Once a month, you will get a report from me on all your review activity. What the quality of the reviews, where they're being posted, what they say. And so obviously the idea is to make sure we have measurable progress. And every month you're able to see that progress and really monitor it. So let's talk a little bit here about what makes my reputation software different. I know many times when dentists will come to me, they'll talk about, well, I'm using Lighthouse 360, I'm using Bird's Eye, I'm using Demand Force. Again, nothing against those companies, but again, you get the same problem that you get with the big marketing companies. You become a number, it becomes robotic, it becomes systematic. If there's no customized strategy, it's not going to be as effective. And so that's again where I'm different. I'm boutique. That allows me to tailor even this part of the strategy specifically to your situation. And I want to make clear, when you look at these big companies and how they do the reputation, it's dramatically different because usually what they're doing is they're collecting reviews on their own site, on Demand Force's site, on Lighthouse's site, on their directories. And you may get 1,500 reviews. That's fantastic. But it's on a private directory where nobody could find it online. The idea is to get reviews, high quality reviews, and make sure they're prominently visible on the right websites, on Google, on Yelp, on HealthGrades, on the public review sites. So, while these big companies are collecting them on their internal directories, and then many times after they fill out a review, they try to push them to the public. What they're doing is they're wasting their willingness to post a review on their own private directory. What I do is I immediately prompt them to go to the public review sites. So instead of wasting time getting reviews on private directories that don't matter, I immediately take their willingness to do a review, which is usually one review, and I make sure that's posted on a relevant site, like Google, like HealthGrades. And so in doing that, it's much more effective than the big companies that do it very robotically. Now, understand I'm customized. Again, and what that means is I do extensive research to determine how aggressive we need to be. So what that means is sometimes when I do those invites, We're doing print invites. We're doing text invites. We're doing widgets on your website, widgets on your email. Sometimes we don't need to be that aggressive. The idea is to tailor it to what you need. If you already have 400 reviews on Google, maybe we need to get them to health grades. Maybe we need to get them to Yelp. So I do research to determine how aggressive and also which websites we need to send people to. If you have negative reviews on Yelp, we need to send them to Yelp to bring that average up. Okay, so we need to make sure you're looking great and you're looking superior to your competitors on every website. So that's the idea. Now, the other thing I do is I monitor the algorithms. Very, very important. Again, big companies, very robotic, very systematic. In my situation, I'm looking at the Google algorithms, determining, okay, right now they're putting a heavy emphasis on Google and Yelp. Next month, that could be Vitals. The next month, it could be Facebook. They change, Google changes their recipe all the time. So what I do is I micromanage that so that when a change is made, you're going to benefit. I'm going to change the way those reviews are routed, and they're going to make sure we get them on the right sites. Now, on top of that, email alerts. As I mentioned earlier, negative reviews, you get email alerts, I get email alerts. We make sure they're addressed. Very, very important. Most companies don't give you that extra notification. And finally, auto posting. You look at auto posting, important with Facebook. What I do is every time a review is posted online, it gets auto posted to Facebook. So in between all those other posts I'm doing on Facebook, you're getting 5-star reviews, 4-star reviews. Now, obviously, I only post the high quality ones, so I make sure if it's a quality review, it's getting posted on Facebook. And obviously that improves the effectiveness of getting new patients through Facebook. So hopefully this made sense. If you're a dentist out there and you've been struggling with trying to monitor the vast number of directories and listings and your reputation, which can be a huge challenge these days, encourage you to reach out to me. My consultations are free. I can assure you at the very least you're going to find it insightful, for most of you quite valuable. So you can reach me directly. My number, 951-696-7550. If you prefer, you can email me, scott@webdgs.com. It's webdentalgrowthsolutions.com. Thanks again. I hope to talk to you soon.